I think we're almost live here. Hey guys, I don't know if we're on yet, but this is Dr. Sandy. we are in our new location. I haven't got my background up yet, but here I am, all plain and normal. Welcome to our call tonight. It is Nurses Against Violence, the Future of Nursing. And I have our awesome folks that are with us. We have Dr. Jessica Whelan, and we have Miss Mary Taylor and Erica Workman. They're admin and moderators in our group. So you feel free to reach out to them too if you ever need to talk. Tonight is a great topic because we're going to be talking about some pretty cool stuff and where nursing is going and where Nurses Against Violence is taking nursing, as well as with Together Wellness, changing the face of healthcare, literally and figuratively. And we are so excited to talk about the things that we have coming up, where we are getting things done on the back end, where you don't really see things on the front end. And we're going to talk to you a little bit about it tonight, because we are really revolutionizing healthcare. So I look forward to be able to have this dialogue with every single one of our lovely ladies on here. And I'm going to be bringing up my phone to see if there's any questions or anything like that. Where do we get started? So Nurses Against Violence, some of you guys know, is geared towards bringing awareness, educating, empowering healthcare workers, as well as also eliminating violence in healthcare. So I also want to take this opportunity to thank everybody on the page and also on the main page, in the group and in the page, for helping us to keep everything civil and to uplift each other, because it is extremely important, because we also are super busy and there's not enough room in this world for negativity, right? We are changing something that has to have change that has gone off the deep end. And we need to take care of, we need to join together and to change this. And it starts with us, each and every single one of us. Not just Sandy, Dr. Sandy, not just Dr. Jessica, not just Erica, not just Mary, but this group alone is like over 9,000 people just in the group alone. That's not including the engagements and the activity that we have around the world that are not only on the page, but also in the group supporting each other. Violence in healthcare is an international problem. And in America alone, we don't even have current numbers. It's that bad. And then now with this COVID thing, it's made it even worse. As far as like the violence in healthcare, because people are panicking. The fear of the unknown, they don't know what's happening, and they're taking it out on healthcare workers when we're already there in the very front line, and we already get that negative emotion in the first place. Now it's even more so, probably like quadrupled, if not, I don't know, like times 10, or 100. So I'm very worried about the future of nursing in regards to what's happening right now. So we're going to talk about some things and opening it up to, I don't even know how to even start this, Jess. Like it was so exciting. Like, okay, so Erica, how do you suggest that we start this?
Do we have any like personal experiences or anything that anybody wants to talk about?
Well, I can say,
or even in the group, yeah.
Well, I don't know if anyone's in there. I'm trying to get on here to see. So what I'm going to do is minimize this and look at my phone. So what I know personally with healthcare, I've seen a lot of incivility, as well as I've seen people being punched, spit on, their hair pulled, scratched. Mm-hmm. It's been pretty bad on the floor. I've been in nursing since I was 16 years old, and I've climbed the chain in healthcare. So I've seen a lot of changes, and especially when 2008 came around. I have not been in nursing over 50 years, like some of our nurses that are watching us, but I've seen a lot in just this short period of time, just graduating from nursing school, and being an aide in the nursing school. It's just with the opioid epidemic and the addiction issues, as well as also the mental health issues that are not being addressed and the stigma that's so thick that nothing is, it's just, it's rough out there. So, and now being an educator, right? So I'm still out in the field, but I'm like an educator now. For mental health, I'm changing the face on the education part. We're trying to get people more so engaged that we're not just taking care of transactions, we're taking care of the whole person. And that is very vital because the nurses are not taking care of each other as well as themselves. And if you want happy patients, you have to have happy nurses, correct?
Yes.
Right. So, and there's a huge lack and a huge deficit of education in nursing school, because the same circle of influence is teaching. When they have somebody teaching maternity mental health, they have not, that's not their specialty, right? But there's such a shortage of nursing instructors that they don't have that component. So the future of nursing on the nursing education aspect is very poor, right? Now, I can't hear you.
Financial game.
Well,
The colleges itself, not just intentionally, it's not just the professor's problem. There's a large issue with universities in general. This isn't just, but there is a greater political issue with universities at large and the delivery of our educational models and how we're delivering education also. And I think that's also affecting our healthcare professionals, especially nurses.
Right. Yeah. Because what you have is you have a curriculum that the curriculum frameworks don't even really touch, but maybe like that much of mental health. It's like a brief overview when that can make or break your whole shift. So if we're not teaching the reality of what's happening in healthcare, then we're really doing nurses and the people that are going into nursing a very huge disservice, as well as also our patients that we're trying to take care of. So, you know, you want good customer service, we need to have good education to back it up. So I love where I'm at right now. And yes, I am going to plug the university. The university itself, where I'm at right now, we are huge in mental health and we have it integrated throughout. And is extremely, it's got to be a passion for everybody to want to make sure that, number one, the patient's taken care of, and number two, the nurse is taking care of themselves. Because if they're not taking care of themselves by being knowledgeable about how to take care of people and recognizing things, even though that they're having all these transactions going on, then they're going to miss these crucial cues of these patients popping off and getting angry. Now, with that being said, that doesn't excuse people coming in off the street and just hurting a nurse. That does not excuse it. That is a safety problem and not necessarily a staffing problem, because we also need to take care of each other internally as well as a system. Because if administrators do not take care of their nursing staff, they're going to hit the road. And you're seeing a lot of that happening right now, right? So especially with, not having proper masks, not having proper equipment, not having, the experience that they need in vents. They're training people that are in med surge as vent techs, or, ICU type, that's kind of scary. So, and having like 10 to 13 vents at a time, Mary?
I said that's extremely dangerous, not only for the patient, but it's dangerous for the nurse and care of the patient.
Absolutely. And then how do you think the nurse is going to feel if her patient dies?
Right.
Yeah. It feels completely, terrible, because that's not their intention. Right. And the way that the illness is going, if the vent is not, there's so many different things, but we're not going to talk so much about that tonight, but just I'm just trying to find us on Facebook so I can see if there's anything that we need to address while we're on. But so there's so many systematic issues that can happen. Does anybody have their phone up? Because I'm like miserably failing with this. Okay, I think I got it. It is very important for us to be able to recognize these issues. So with that being said, the future of nursing is right now. And we have a lot of people that are, out there. What kind of things do we have going on out there? What are people selling, and what have you guys seen?
Well, I think I want to backtrack and be like, why is this happening? I see nurses frazzled and underpaid and overworked and still trying to make ends meet. And so what are they doing? They're selling, they're doing things, they're trying to find extra income within the realm in which they can. But it's interesting because they're so tired, they don't want to necessarily pick up extra shifts.
Right.
So they're seriously turning to everything outside of nursing if they haven't already left nursing. So I'm seeing the Jamberry, the Mary Kay, the Amway, the Rapid Pay, whatever it is, it's being sold. Like every pyramid, every plan, every piece, every cranny, if it's sellable, it's on a unit, it's somewhere, it's being done. I feel like it's every attempt to make that extra dollar, and there's always this is my plan out. Once I get this going, this is my, also that, what was that one? It was the greens and the everything. It was like, this is still healthcare. I'm selling these vitamins, and once I get this going, I can leave, but I'm still selling vitamins. Like, I felt like there was so many just doing those things, and it was like, this is my way. This is how I'm going to get off the unit because I can't be here anymore. I can't do it. That I've seen that, and I always want to know the whys. Is this happening? And along with, this is what I see happening. And so yes, I see a lot of the sales and I need to find a different avenue to make money and to pay my bills and to put food on my table and to dream of something different because I'm feeling so oppressed. I need a vision. I need something that I feel in control of. And this is my little piece. This is my little thing. That is my business. I have control over that. I don't have control in this space, but I do of my Jamberry. I do of my Scentsy. Like,
I got some
Can I
great
speak to
senses.
that a little bit, Dr. Zeth?
yeah.
I've seen that actually in the group recently, a lot of people. And it kind of, I feel like it goes back to what you were saying before, Dr. Sandy, about that mental health piece, but how nurses aren't taking care of themselves.
No.
So you're seeing that burnout. They're like, I love people. I love taking care of people. I love the bedside, but it's not about that anymore. It's about how many roles can you fill and still be useful to us. It's how many, like, it's all, these crisis people, and now they don't need crisis workers anymore because they're just taking that OB nurse and putting them on the vent.
Right.
Yeah.
And I've seen people posting like, they don't have a vagina, and I don't know what a vent I don't know what it does. So, like, what am I supposed to do? And you're setting that person up for failure. You're setting them up for burnout. And
Right.
so that's like the cycle that you are seeing just perpetuate itself. It's heartbreaking.
Yeah.
People don't like to fail. People historically want to feel like they're going to succeed. If you set them up for success and you build them up and you put them in a position where they're going to thrive, they will thrive. But we are not setting them up for thriving. No. We're oppressing them. We're giving them shifts that are unreasonable, care loads that don't make sense.
We have a solution for that, right?
Of course we do, because
Yeah. Like, so
I was that nurse on the floor and went every step of the way hoping it would get better, only to find out at every level it still sucked.
right, but we also have something that is changing the whole game. Like, we have Mary and Erica, and we have Katrina, and we have Lisa. We have so many people that are coming on board with us, and we're so excited to be able to talk about a little bit about it tonight. Not taking a long time, but it's called Together Wellness. If you have not seen it, go to TeleDocN as in Nancy P.com, and you're going to be able to see a brief overview on there. I have a webinar thing, a little example. But what is so awesome about it is, I'm going to let Jessica talk just a little bit about it. But Mary, you came on board with us. What was something that you were thinking that you wanted to change in your own practice?
Well, pretty much it's like something Jessica was alluding to, as well as Erica. Feeling the burn, feeling pretty much out of control of what you know you should be doing as a nurse. Going against your code of ethics in many instances. I just got to the point where I said, I had been thinking about it for the past several months, and then I saw you young ladies, and I went, this is the right time. This is the right time to do this. So it all fell into place. So that's what I needed to do for myself.
Exactly. So what we have, I'm sorry, I didn't mean to.
Oh, that's okay.
I didn't know if you were done. My computer lags a little bit. So what we have is, Together Wellness is a marketing, consulting, and education company. And what the department that we have is telehealth and telepsych. And we're super excited about that because not only we're going to teach you, like we have a component that's going to be able to teach you how to build your own business, but it's also it's not just your own business, but it's also giving you the independence to be able to work for yourself instead of selling some multi-level thing. You can make, like, just saying a rough estimate for an average RN, you can roughly make around $120, $160 an hour. I mean, come on, like, we can tell you how you could do it super easy, and you're going to be on board with us. What was that, Jess?
I'm sorry. You should just start over.
How much they're making. Like, if you just think, I constantly think back, how much work are you doing in that hospital? Because I was there. How much, like, if you saw the billing codes that they're billing on you, and like the work that you put in, and that CEO drives rolls, and then he's got like 6 other cars in his parking garage and his 6 homes and everything else, and you're exhausted and just like going home, and your feet are sore with bunions, and your freaking whatever those shoes are that look like ducks. I can't even remember the name. Thank goodness.
Alligiras?
Yeah. No, there's another one.
I got like 6 pair.
There's another brand that I had, but they never fit my feet right. So this and they'd always fall off, and I'd always flip my ankle. But
those Crocs?
No, Danskos. No.
Danskos. I always would like spin my ankles on them. They're supposed to be the best non-slip shoe, but for me, they were. But anyway, yes, the Danskos. Your Danskos are sore. Your Dansko feet are sore with bunions, and you're coming home, and you're just like, oh my gosh, I'm exhausted after my 3rd 16-hour shift in a row because they mandated overtime, and I got no thank you, and they just told me I might get mandated again for my 5th shift because they're not going to use agency nurses. And I've been there.
Yeah.
And you're just like, somebody is not doing that. Somebody is going home, like somebody's billing off of that. And when I got in, and I got into healthcare, actually escaping other industries first. I'm a 2nd-time career. Like, my first degree isn't even nursing. My first degree is actually in technical theater. And I know, really.
Wow.
Little known fact. So I liked doing all the stage management and operations and everything like that was but acting. I was not the on stage person. And so yes, that 2nd-time career person. And I got in because as I started doing other businesses, because obviously theater wasn't going to pay the bills, and I started learning other businesses and things, and I was like always that super ethical idealist person. I would get in and I was like, oh my gosh, I can't believe this happens, and that this person and this thing happened. So I actually sought out nursing because I was like, this has to be in alignment with, you know, when you go to school, you get your degree, you get your respect because of your degree. And then I got in there, and as I started working, I was like, oh my gosh, this is like out of all of the careers I've been in, the most unethical crap is happening. Like, what is this? And like, as I went along, I saw all these things that was just like, it was like putting my hair just on fire. As we were like, I always hear that phrase, and I was like, yes, everything was just lighting me up. I was like, I can't believe this happens, and I can't believe this happens, and I can't believe this unethical billing, and I can't believe. I hear so often in practices, and I was just talking because one of the things we're working on is with United Healthcare and trying to drive this change. Is trying to work on a project with them, and I was talking with them about how, the insurance is always painted to be the big bad evil guy, and yes, they make money, and you can see in their profit lines, but they're not altogether bad. They're in some ways with patients kind of neutrality. They don't have like this ulterior motive of harm to patients, because honestly they do want their patients to be healthy, because if you're unhealthy, then it does cost them money. So ultimately it is a cost risk analysis for them. It's all numbers. But when their systems aren't catching up on fraudulent things, because let's say all of the hospitals in the United States are charging an extra penny here, charging an extra penny there, hiding the numbers there, hiding the numbers there, their systems don't pick up on that. So that operational waste is getting missed all the time. And we wonder where our money's going in healthcare. That operational waste, that fraudulent billing, all of that stuff is happening all the time. And then I hear it in private practices. The doctors are mad because the administration, they're like, we have to hire more because of the paperwork, and we have to do this. The insurance is trying to cut off some of that excessive waste. And then they're just like, well, screw it. I'm just going to basically screw the insurance, and I'm going to, mark up my charges. I'm going to do this. And I've seen it in so many places I've been. And then the unethical, and it's like, I'm going to screw them back. I'm going to screw them back. And I'm just like, my eyes, because I'm the naive Aspie person. I'm just like, watching as these things are happening. I'm like, what are you doing? And that's where we've seen it's gotten out of control. And this is where we can make the change. This is what needs to change, because if we're going to change the system, it has to happen across the board. There's so much we can effectively do, and nurses can drive that, because we really are at that forefront, at that bedside, knowing our patients, knowing the system. We've been at every level, working inpatient, working outpatient, working community. We've done it more than most of the other disciplines. We hit every area. And that's what makes us very unique in the healthcare model. And that's what's going to help drive this forward. And what really excites me, and what we get to bring to the table, and why we can really make this change if we also bring the positive, bring the drive to change it. We do have to light that fire up a little bit. We've got to turn that one more time, turn that pilot back on, whatever it was that we had in school way back when, before somebody snuffed it out and said, oh my gosh, like, because remember they said at one, I remember that cranky old nurse that was like, you will one day, it'll burn out for you too. You'll be just like the rest of us. You won't have that like same passion. And I was like, screw you, I will. Turn it on one more time. If it has snuffed out, we have to, because we can effectively do it. And I've believed that, even with the things I've seen, and even some of the nurses that are coming on now, I know that I almost reached that point, and I told my husband, I was like, I wanted to get out, like right before this idea came. I was telling him, I was like, it isn't my patients. I love my patients. I love making them feel better, but healthcare it's killing me.
And I think that was like, right, like, wasn't that like kind of like we met, you and I, Jess, we met a couple years ago. And we met through the American Nurses Association, through their mentoring program. I don't know who was mentoring who, but I have no idea. But I'm glad that they kind of got us together, because we, I was talking about Nurses Against Violence Unite, and she's talking about like how, and like we're both in sync, and we're both talking about all of this crap that's going on. And I'm talking about how nurses are getting hurt on the floor and nobody cares about us. And she's talking about how people are screwing with her as a nurse practitioner. And I'm like, we're getting hit and punched and all this other stuff and nobody cares. And, and so it's like kind of been like this great little like sisterhood that we've kind of like put things together. And with Nurses Against Violence now being a registered trademark is, the catalyst for change on the part of stopping the violence, right? So with Together Wellness, we're going to start taking care of our nursing population, our healthcare family. That means not just nurses, the CNAs, as well as also the doctors, the respiratory therapists, all of our healthcare family. And then what we're going to be doing is eventually we're looking into other avenues for Nurses Against Violence. That's soon to come. I'm not going to talk about it right now, but we are changing from the inside out. And if you're not understanding what we're doing and the whole thing with Nurses Against Violence, we're changing. This is such a big, massive thing that we're changing. It's not going to happen overnight, but we're getting very close to you starting to see on the other side of the changes. But we need everybody to find that fire, because if you do not have that fire and that desire to bond together arm in arm to make this change happen, not only from the inside, from the healthcare part, working on the floor, but also taking care of each other and being civil and being kind. Because let me tell you something, when you thank somebody for, just saying, hey, thank you very much for getting that light for me. If, if there's something that you were struggling with, like you had like people crashing and, the whole assignment, your whole assignment is crap, and people coming to save you, not just the rapid response, but your teammates, that speaks volumes. And we're gearing away from that. Some places are telling me, some people are telling me my nursing family is not bonding with me. They're not seeming like they care about how I'm doing. And the administrators are putting more on us, and we're getting paid less. And what I was saying in the very beginning was that what we have for you is Together Wellness. Together Wellness is going to take nursing at a different level. We have a telehealth, telepsych business that's a component of Together Wellness. And what is happening is that we're going to start giving independence back to nurses, to give you the autonomy to be able to take care of your patients the way that you feel that they need to be taken care of within our Nurse Practice Act and the patient's rights, and to be able to give them the care that they deserve and they need, as well as also taking care of yourself by having the schedule that's flexible, having the ability to be able to say, I need a vacation, and having that vacation and taking it, and to be able to enjoy it because you're making the money that you would be able, that you wouldn't be able to making $25 to $50 an hour on the floor, and then traveling and doing all of that stuff. You could work at home in your own house, or you can have a business, or you can have, a build your own brand. You can build your own brand. We're going to be teaming up with insurance companies very soon here. So it's very important that you understand that there's another avenue besides selling Herbalife, which is a great product, selling nails, which is also probably a good product. You can't really have nails in nursing, but also you can have like the designer chapstick as well as also, but you understand what I'm saying? You can be able to afford the things and get away when you want to get away with the income that you're going to be making, as well as providing for your family the way that you feel that they need to be. That your schooling is going to propel you into the next category of your career, that you're going to be able to take control of your life, and you're not going to live inside of that little box anymore that employers have put you in. I'm not saying you need to quit your job. What I am saying is that, how you started with the MLMs and selling like the little candy bars for your kids? Well, guess what? This is kind of different. This is actually, you're building something for yourself to be able to have, the independence and the freedom that you deserve, as well as to love your job, to love what you do. because we have not really realized how much we love nursing as much as being able to provide our patients with everything that they need. There is gaps all throughout healthcare. There's gaps for elderly. They don't want to go in nursing homes. They want to stay as independent as they possibly can. We have the people that are addicted to even healthcare family that is addicted to drugs and alcohol. Well, why are they addicted? Because they have that pain, right? That pain that has their mental cage. They have that pain that they're just they're struggling every day because they have nobody to talk to. Well, how about you be a life coach and maybe be able to take care of them and help them relieve some of that pain, to know that they actually have a friend. We have an enormous amount of sadness and loneliness in society. Well, why can't we fill that gap? Why can't we take care of people the way that they need to be taken care of? And not just because of a paycheck, because that is our mission in life. That is why we became healthcare providers. That is why we became nurses, to be able to give back the things that we have learned in more of a skillful way. So it is very important for everybody to understand that what we have is not just another MLM. It's not an MLM. It's not something that you're good. It's not a like overnight type success and then you flop. This is something, if you really work at it, you're going to get far with it. We're just about the launch, we'll just say. And things are really like, people are starting to build their brands because they see what's happening. They see the potential that we have, because what Nurses Against Violence brings to the table is affecting Together Wellness, because we have civility, we care about each other, we stand up for each other, and we understand that in order to be able to grow, we all have to be together. And this goes along with Nurses Against Violence. And this goes along with everybody that decides that they want to work with us in Together Wellness. Everybody has this common bond that we need to change healthcare. So with that being said, like, what are some ideas that you have, Erica? I would like to hear some of your ideas, just, briefly. And then Mary, I'd like to hear some of your ideas on what are some other ideas that I touch on? Like, I was talking about the granny check business. I was talking about like the different ways that you can build your own brand.
Yeah, so I love that you pointed out a bunch of different things, actually. So one of the things that I'm contributing to in part as part of this movement is that I started off kind of like Dr. Jess was saying. I was like, there's got to be more to it than this. And I got into healthcare and I was like, I am here for holistic care, that holistic care that I learned about in nursing school. And there's none of that. Nope. It's what pill can I give for the side effect of that pill, for the side effect of that pill, and nobody is getting better. And that just alone frustrated me to the point that I said, screw that, because I know that I can do better. I can be better than the system. So, and that led me to, I've gone on and still on my own holistic journey, but what drove me to health coaching was that. And I wanted to find the perfect balance between, I love nursing, but I don't want to leave the bedside, but how do I incorporate that into my health coaching? Because I can't, because there are so many legalities around it. And that was the beautiful part that I saw in the model of Together Wellness, is that I could put them both together in the correct way and still be able to help people that to the best of my abilities, because it really is a holistic model. The telemedicine in and of itself, like you were talking about, Dr. Sandy, there is always, I say in a very vague and general sense, but there is always a root cause that is normally some sort of internal, psychological, emotional, for whatever happens. It's not the addiction, it's the emotion that's driving the addiction.
Yes.
So a lot of times, so a lot of times if we get to the bottom, we can kind of work at it from like the inside out. What are you doing?
I'd say Maslow's shouldn't have been a pyramid. Maslow should have been a unity circle.
It's Maslow is like, we've missed a lot of those marks in nursing, period.
Yeah.
There is no toilet break.
There's always that psychosocial. I've always told my students that it doesn't matter if someone is bleeding out, if they don't have the will to live, even if you did everything right, die. Because if they lost their will to live, they lost their will to live.
Yep.
Yes.
You have to
100.
still instill, you still have to have that psychosocial component met. So Maslow, I said this even in nursing school when I was learning about him, I said he's a piece of crock. And they said I was crazy in nursing school. They probably still say I'm crazy today, but whatever. But I believe in those psychosocial needs so much that it's true, though. That we have people that die from broken heart syndrome. It's a real thing. After
Yes.
spouse is dying. So there is that real truth to our brains hold so much power. Our spiritual and our energy forces inside out, our environments play a very key role to our being and in our existence. And if we're not addressing that at the same time that we're addressing those basic needs, whether it's airway, breathing, circulation, if we're not addressing them at the exact same time, at the exact same moment, patients can still expire because we're not looking at the whole picture at the same time.
Yeah. So Mary, what are some things that you were thinking of that while we're talking? What do you
Well, you and I were talking about this one day. I was thinking of possibly working with physicians and being like the pre-check-in for the physician and see their patients ahead of their visit to try to prep the physician so that he can better answer their questions, concerns, and then also follow up with the patient and see if they themselves have questions and concerns. And we know oftentimes they don't take everything away from the visit that they should, forget things. I don't understand this. And maybe they're too proud to ask a doc, oh, he seems awful busy. I don't want to bother. I've heard patients say that. I don't know. I've lost count of the number of times. Oh, I don't want to bother. You're too busy. So hopefully something like that would work. I gotta put it all together, but
what's so nice about it is that you can use you can be an independent contractor and consult for this company. You don't have to wait to be paid from insurance companies. You can build your own brand by saying, okay, so this is my rate. You don't have to come in and think that, okay, well, if there's an insurance company, then I'll go ahead and I'll start working. You can come into this thing with your own model, with your own deal that you have going on. This means doctors, nurse practitioners, nurses, RNs, LPNs. If you already have your deal already going on, incorporate that in what we're doing. Because what's going to end up happening is that you're going to propel yourself and you're going to be the nurse boss, right? Because that's what we want. We want you to be independent. We want you to have that autonomy. And then that's what we're also here for, to be able to help you grow and to grow into that role. Even if you wanted to be a legal nurse, well, we have a program to teach you legal nursing. We have a program that will be able to help you, talk to build relationships with doctors' offices. Dr. Jessica has a certain class for that. We also are going to have, we're still building some of these things because, I'm still in school, some of you guys know, but so my timing is very off right now. But there are a lot of things that we're working on that are going to help build you as an independent provider. It's very important that people understand, you don't have to wait for other things to be starting, because, the future of Nurses Against Violence is very bright, and we're going to have, I'll just leak it a little bit. We're working on an idea of having a third-party insurance company, because this is something that I've wanted to have. So nurses and healthcare workers don't have to get insurance from their work, that they can get it from Nurses Against Violence. It's going to be a different kind of model. And so we can have affordable healthcare without having to worry about employers price gouging us like they don't mean to.
oh my God.
But paying $1,300 a month for insurance is a little outrageous for a single mom and kids. Just an FYI. That's pretty pricey. So, and I'm healthy, right? And then my kids are healthy. So why am I paying $1,300 a month? Well, you're finding a lot of people that don't want insurance because of that. That's first, and that's one thing to think about. Then you don't want your employer meddling inside of your mental health care either. So how about we have that independent from your worker and your employer? How would you like to be able to have control of your own health care and have it affordable and have it within an organization that's going to help protect you? On top of that, to have the most important and the most innovative reporting system ever on the face of this earth, that I have to get somebody to help us with the computer program. So I'm working on that, where it is going to be a reporting system. It is called the Risaldi Enhanced Anonymous Reporting System, otherwise known as REARS. And it is going to be a shot to all of the healthcare organizations that are defrauding the system. So yes, that was another slogan. I'm good with my words, my slogans, my little marketing ingenious. So I had a little help with that name, but so needless to say, if you find fraud that's going to be happening, as well as also you've had a doctor come at you or another nurse or something that was completely unfair, and we work with you to make sure that you have all your documentation and stuff like that in your CYA, and then we report it to the agency anonymously and or not anonymous, but it would be through a third party. So it just depends on, everything's going to happen one step at a time. It's not going to happen overnight, but Together Wellness is on its way. So we're looking for nurses, we're looking for nurse practitioners, we're looking for life coaches, therapists, and doctors, psychiatrists. We're looking for everybody. So if you know of anybody, come to TELEDOCNP, and I have it in the comments. Oh my gosh, you're so funny, Erica. Rears. Right in the rear.
I am trying to multitask here. If you see me, I'm not distracted. I'm trying to
No, you're amazing. Thank you. I appreciate that. So, and that's what part of a team is about, is that we are all working as a team, because what's going to help me and help Erica and help Jessica and Mary, it's going to help all of us, because that's what we're trying to do. We're changing the face of healthcare.
This culture, as a reminder, because there's something from the graph, and I will emphasize this, is that it is going to be infused and stinking of trauma-informed care and supportiveness, to where when someone asks a question, my number one beef is when it's I can't believe they don't know that. Okay, this is an educational model. If someone doesn't know something within our family, we teach them.
Right.
Yes.
Teach them, because who knows what happened at that day, at that class, at that school, or whatever. That's what we're here, is to help support each other to be successful, because everybody's success helps everyone else's success.
Exactly.
That's what's going to change this. 100%.
That's it.
100%. I wish it was like accolade, because really, all of that.
Yeah, absolutely. And we're changing it. Guys, it's only a matter of time. So if anyone's interested, which I think everybody's interested by now, send me a message, send Dr. Jessica a message. We'll be happy to assist you. You can even, if you have, if you see Erica or if you see Mary, ask them about it. We're still in a little bit of the beginning phases, but we're starting to dive in soon. So just letting you know, we need people that are going to be coming on board and that want to do something with this whole model, because it's amazing. It is, it's so big. You would just have to see it for yourself. So it's just absolutely going to flat out change the face of healthcare. So,
Can I offer?
That being said,
Can I offer just a quick recap? Because there's at least one person I know who just jumped on. So just to recap how innovative this whole model is, because not only is telemedicine up and coming, but this is nurse-run telemedicine. And if everybody who's ever been in the hospital, who's that face that you see every single day Who's the person who like really changes? Who's the person who advocates for you? Who's the person who does all the heavy lifting, literally throughout the entire hospital? So who do you think is going to change the face of healthcare? And that should be simple enough, right? Exactly. Oh, thanks. That was nice. So, I mean, just to recap, I mean, so this is an innovative model. So it might not be like, well, this is scary. I've never heard of anything like this before, because it's innovative, because it is up and coming, because you guys are the first ones creating it. So I really want to, thank you and applaud you for doing all the hard work, because that's a lot of heavy lifting. And I can't even like stomach looking through contracts, and my eyes are glazing over. I'm like,
writing them is intense, but
so
because the rest of the team is important. I don't want to minimize them. Yes, bringing the new is new and novel, and also bringing in the new ideas, because I herald this model is also about, like you, Erica, bringing in Reiki and bringing in holistic and bringing in all of these things. We want new and innovative too. That's what the Jessica Whalen Holacracy healthcare model, which is incorporated in the Together Wellness and what the driving system behind this is about. Holacracy is about people retaining individualism within a greater whole. So I want people to bring their individual selves and to bring these pieces of themselves, what they're passionate about within their organizations, to this is also that's part of it. Oh my God.
Awesome. Mary, we love you.
I love you too.
So we're going to wrap up tonight, but we're going to have another next week. I think it might be Tuesday, it might be Wednesday. So I'll just make sure I send out an invitation. Thank you very much, ladies, for taking the time, and thank you at home for watching. I know this is, we intend to do this short, but it usually intends to be short, but it turns out to be about an hour. So, but thank you very much for, you can hear my voice. Thank you very much for jumping on with us. And, it really means a whole lot to us that you're here with us on Together Wellness, and also definitely Nurses Against Violence Unite. Please invite everybody. I'm running a promo for these awesome stickers that you could put like everywhere. We're going to get them bigger for the car, and like they go everywhere. Like I have them on, my Tumblr. I have them on my car. I have them on my phone. I mean, you could do so much with it. It's a clear case. And then it is what it is. And plus also we have t-shirts, we have all kinds of stuff that we're going to repost. So listen, guys, the sky's the limit and beyond. Like, let's just get this thing rocking. And again, thank you everybody for coming on tonight. And I look forward to seeing everybody again. Let's keep this group wound up, everybody support each other, love each other. And if you see something that's not right, report it and we'll get right on it. Sometimes it takes us a minute, but we will be right on it. It's not, if it's anything negative, it's not about what we believe in with Nurses Against Violence Unite. Stick up for us because we're sticking up for you. And thank you very much, guys. Have a great night.
Bye.
Bye. Thank you.
Bye.